Hello, welcome to Riversoft University. My name is Shelley Wolf, and today we are going to be reviewing different types of notes and how they affect your patient's status. By highlighting a patient and clicking on Clinical Notes, you will have the opportunity to pick from multiple notes. When your patient is added in Riversoft Office, they are added in an incomplete status. From this incomplete status, you have the opportunity to do a start of care, complete and lock it. This will cause your patient to be placed into an active status. You also, from an incomplete status, have the opportunity to fill out a visit non-admitted note. This will cause your incomplete patient to be placed into a non-admitted status. If you chose to do a start of care note and made your patient active, at this time you may wish to complete a transfer note. A transfer note will cause your patient to be placed in a hold status once it is locked. From that hold status, you may wish to do a resumption of care note. Once the resumption of care note is locked, this will cause your patient to be placed back into an active status. Or you may wish to discharge your patient from agency. When your discharge from agency note is locked, this will cause your patient to be discharged from the agency. If you do not wish to discharge your patient from the agency and you only wish to discharge a specific payer, you can do that by selecting Discharge MSW, OT, PT, SN, or ST. By discharging a particular skill, you are required to meet or not meet all of the ongoing remaining interventions and goals to discharge this particular skill. When this skill is discharged, this will reflect on the schedule so that no visits for this discharge skill are added after that discharge occurs. You can also discharge a payer. By discharging the payer, you are stating that the payer will no longer be covering those services. Once a payer is discharged, it will discharge the patient-payer relationship. So, on the schedule, it will be reflected that any visits associated with this patient for this particular payer after the discharge payer date will be reflected as non-compliant on the schedule. This is a review of how notes can directly affect the status of your patient when those notes are put into a locked status. Thank you. Bye-bye.